Hey, good morning, folks. Sorry for the delay.
Welcome from Circuit World.
Yeah, welcome to Circuit World. We had a couple of technical issues here. I hope everybody is still trying to get the broadcast. As you can see, BKP is not here. BKP is on assignment. BKP is up in the Northeast doing some family time and doing some remote broadcasting. Anyway, good morning from Circuit World in Blue Ridge. I'm going to be your host today. RFG, Rick, you know me from the All-Star panel. We're going to skip the monologue section. I had a really nice one. I'll save that for the All-Star panel. But we do have Dr. William Whaley this morning. We've got the All-Star political panel coming in later with Bruce, Jane, and Richie. We've got North Georgia Senior Living with Jesse Barton, the Community Relations Director from Cameron Hall and LJ, and the Pet of the Week from the Humane Society of Blue Ridge. So normally we take a break at this segment, but because we lost about 7-8 minutes, we're going to go right into our session. Good morning, sir.
All right, let's get it. You ready?
I'm delighted to be with you.
Yeah, it's fun, huh?
You got a big trip planned, huh?
Yeah, I do. A good trip planned. And here it is, beautiful downtown North Georgia. We still need another half an inch of rain.
Yeah, we
do.
do.
Behind, so I'll give you a rain report.
Okay.
All right, go rain.
All right, let's go to our first question for the doc. And again, we want to thank Georgia Cancer Research, affiliated with Northside Hospital, for this segment. Question is, patient has to have gastric cancer surgery next week. How soon can this person get back to eating normal food? And are there any foods that they should be careful with after surgery, or anything definitely to avoid?
All right. Well, you always ask the question, you want to know age and sex and so forth, which would not be important with a gastric cancer question. But put that first picture up of the stomach. They didn't tell you what part.
That's a factor. That's a factor.
Yeah, you kidding me? Look at this. You've got about 7 parts of the stomach.
Right.
You've got you got that up there for me? Mm-hmm. All right. So the upper stomach, the esophagogastric junction, is the bottom part of that's gastric cancer. Down at the other end, where it empties into the small intestine, the pylorus and this antral portion, which is the opening of the pylorus, is another part. Then there's this huge bit in the middle. So it makes a ton of difference which part of the stomach you're talking about. For example, I have a patient that just had a resection of a part of the gastric. If you look at the back part here, the body of the stomach, took out about that much stomach with one of these cancers that has a bacterial cause, which we'll talk about in a few minutes. Did it with an endoscope, kind of like the hip replacement we're talking about. Went in the morning, had the surgery in the afternoon. Went in the morning, had the surgery in the morning, and was home by 6 o'clock.
Wow.
Yeah, and on a liquid diet for a week or 10 days or something like that. The alternative is, I've had a patient recently who had the entire distal stomach from about that part where it says body all the way to the end, including the proximal end of the duodenum and small intestine removed, and that surgery took about 10 hours, and you'll see later with all the lymph nodes, and that patient will always be on special foods. And they had to dissect all of those lymph nodes, so the surgery takes 10 hours, and the patient's in the hospital for a week. So that question really doesn't have a very easy answer, and so we're going to get away from trying to focus on that question about what food can I eat and so forth, and talk a little bit about gastric cancer as a disease.
It's okay? Just as a in total.
Yeah, right. So first of all, the part of the stomach, go to that next one that says presenting symptoms, if you would, Josh. The symptoms that would get you to the doctor and get a diagnosis of gastric cancer could be this gastroesophageal reflux, which you have, I have, he has. 80% of people have the heartburn symptom from time to time. If you have it frequently and a lot, we talked previously about irritative lower esophageal cancer, Barrett's esophagitis. So it could be difficulty swallowing. At the other end, it could be ulcer-type symptoms when it's down at the bottom end. So in terms of symptoms, over 65% of people will have weight loss. but only about half have abdominal pain. And then after that, they're nonspecific. Nausea, I have a little trouble swallowing, my bowels have changed, or I don't tolerate the big meal like I did, and that sort of symptom. So go to that next one there, because you think about what can I do to prevent cancers, right? You always want to know about prevention. So pop that next one up. Factors increasing the risk of gastric cancer. Well, what's the first one?
Age.
I'll be darned. Second one.
Gender.
Yeah, men get more. Why? They drink more liquor, they smoke more cigarettes. And there's a population issue. I think I've said before that people who live in Japan cook their food on hibachi pots, and therefore have a whole bunch of stuff that's been charcoal broiled, have the highest incidence of gastric cancer in the world. But there still is some kind of a genetic predisposition. Hispanics, Asians, African Americans do have more than Western European Caucasians. So let's go to this next one. We're going to get into a little bit of prevention. That's what it says, causes. You got it? What's number two?
Obesity.
What's number one?
Smoking.
All right. Now, I don't pay much attention to the diet rich in smoked, pickled, and salty foods. right.
Put the chips away.
Yeah, right. Put the chips away. Remember the thing I said a week ago? I think it was with you the last time, talking about the fried foods, 3 servings a week. All right. And in North Georgia, what's the next one? Working in
coal,
mines.
metal.
Okay, you got Copper Hill over there, right? All right, and there is, when it talks about having previous ulcer disease, we had a thing, just pull them all off for a minute. We had a previous segment, maybe a month or two ago, about H. pylori, which is the bacteria in the stomach. Back in my early training days, we thought that ulcers were due to stress, ulcers were due to too much acid, and the treatment was Tums and Rolaids and Gelusil and Maalox, which were the only antacids available. Stress, tell you get out, quit your job, or we didn't even have Valium then. Give them some phenobarbital or something. But we've learned now that 85% of ulcers are associated with a bacteria called H. pylori. And if you diagnose H. pylori and eradicate the H. pylori with antibiotics, the ulcer goes away. And there are early gastric cancers that are related to the H. pylori, that antibiotic therapy for the H. pylori cures the cancer.
Dr. Whaley, how far back was that transition between, it's stress, cut your stress, and then all of a sudden the bacteria thing was discovered?
I'd say 20 years, something like that.
Really?
Yeah, because
okay.
I've been doing this for 48, so my memory might be
You started when you were 13, huh?
Yeah, right. I started just before I was born. All right. So go to that next one there about alcohol for cancer prevention. This is, it mentioned in there smoking and alcohol. We always talk about cancer prevention. They recommend not drinking alcohol. Then over here on the other side, you got the cardiologist telling you
better have a glass of red wine at night, huh?
Right. But remember now, heart disease is 40-50% of people. Gastric cancer is 5% or so of cancers. I mean, so the heart disease way outweighs the gastric cancer in terms of risk. So here is the definition of acceptable drinking. It says, if you do drink alcohol, limit to 2 standard drinks for men and 1 for women. And the standard drink is a regular beer, 8 or 9 inches of, quote, malt liquor, 5 ounces of wine. When you get that at a restaurant, you think they've shortchanged you.
That's right.
And a mixed drink with 1.5 ounces. And I guess that's about what the pour is in a restaurant. So that's acceptable drinking in terms of the risk for malignancy, and it's about the same as you would get the heart disease people to tell you ought to be drinking.
Now, where did that standard come from? Well,
They pulled it out of the sky. it's statistical related to the incidence of esophageal, gastric, and other cancers, and breast cancer. And that is, they did, that's a risk.
So this is a long-term study?
Yes, many studies.
Okay.
The Nurses' Health study, which is like 200,000 nurses, and 200,000 nurses. Then, if you nursed or didn't nurse, how old were you when you had your first period and your last period? Did you smoke? How much alcohol did you drink? What was your weight? And somebody a lot smarter than me has to put all those things together and say, well, look, once your weight gets above a BMI of 30, the cancer incidence goes up. Once your alcohol intake gets above 14 drinks a week, your alcohol intake goes up. So it's a real complicated statistical analysis. And what we want them to do is just give us a simple answer.
Yeah.
I've got this B12 shot I'll give you once a month, and you'll lose 40 pounds, and your hair will turn back black, and you'll
Can I make an appointment for that?
You'll be rich and good looking. That's what everybody wants, is a quick fix. All right. Okay. We'll get along here, because we got a little time constraint. Show those two gastric pictures. So you went in here with one of those symptoms. I believe that conservative therapy is worthwhile for the dyspepsia, the ulcer symptoms, for a while. I didn't say for 6 months. I saw a patient a few days ago that was treated by a series of family physicians. Each one of them saw him in sequence and did watchful waiting. Okay, nobody watched and waited longer than 90 days. But 3 waiting 90 days is a year, basically. And this patient had a gastric cancer that, in my opinion, if it had been diagnosed 6 to 9 months earlier, would have been, I didn't tell him that much, would have been at a lower stage, less surgery, and a higher chance of cure. So now you've got these symptoms. They didn't get better in 30 to 60 days. Or if you've got that weight loss, if you've had an involuntary weight loss of 10%, your belly hurts, you don't go to the antacids and conservative therapy. You go straight to the gastroenterologist, who sticks a scope down there. Now, I just got to tell you, the top picture up here is a. Can you tell the difference between which one's cancer and which one's not? Because really, they're both a hole in the stomach, aren't they?
Yep.
Anyway, so you've got to know what you're doing. The fact that the folds roll into here, you see gastric, you actually can see that fold roll into the ulcer. Mm-hmm. That is a sign of a benign lesion. The fact that there are no folds going into that one, sign of malignant lesion.
It's got definite margins, huh?
Yeah, but you can't tell the difference by looking at it.
Right.
That's the point. You got to biopsy both of those. So you got to be in the hands of somebody who knows what they're doing. So let's go to that next picture. And this is why the surgery is so complicated. You know that when we do breast cancer surgery, we go for axillary lymph nodes,
yes.
Right? Okay, you've heard that story. And so when you
axillary right under the armpits.
And if you go for colon cancer surgery and you have no lymph nodes involved, your stage is such that you generally don't need to take chemo. So the lymph nodes are a really big deal here. But if you'll notice, there's about 50 nodes scattered around that stomach. And if you look at the bottom picture, they can go all the way out to the spleen, over into the liver, way down deep. And that guy that I told you that had about 8 or 10 hour surgery, he had lymph nodes that went over here, and they had to take his spleen out, and he went over here, and they had to take part out of the liver. So even though all the guy saw at surgery was an ulcer, even though the CAT scan said there's some minor, not specific lymph node enlargement, the nodes weren't big enough on a CAT scan to say we probably shouldn't operate on this guy. So when they get in there and start finding those lymph nodes, the surgery just goes on and on. So this question does not have an easy answer. Basically, I'd say you need to be in contact with your surgical, medical, oncologic team. A person with gastric cancer at our Northside Cancer Institute will be presented to a combined modality conference that will have gastroenterologist who's doing the scoping and would have to handle any sort of feeding tube you were asking earlier, mm-hmm. or small pouch left over in special diet. Surgical oncologist is the guy who's going to have to go in there and do the work. And if it's high in the stomach, a thoracic surgical oncologist, because he's the one that's going to have to get the higher nodes around the esophagus. a radiation therapist who may say, well, look, with that much disease, we can do a better job or an equal job with radiation. But the guy who should be directing the band would be a medical oncologist. Because a medical oncologist may say, you know, what if you got all those lymph nodes and you do that big old surgical procedure, he's still got a 78% chance of relapsing and dying. And if you give him chemotherapy and radiation, he'll have a 78% chance of relapsing and dying, but he won't have to go through a big operation. So what I'm saying is there's a whole orchestra that should be answering those questions for that patient.
I got it. Got it. All right, let's go to the next question.
This one's going to be fun.
Yeah, okay. Again, we want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. Our second question is, this can be fun?
Yeah, a lot of fun.
Can testosterone therapy lead to heart problems? I'm in my 30s, I'm really not, and have been on testosterone for a few years, and my wife is worried it could lead to heart problems.
You got
Any relationship?
You got a smart wife, number one.
Okay.
Number two, you're telling me that you probably still have a relationship with your wife that includes intimacy. That's the way that question is asked.
Yeah.
So the first one's going to be the 10 top benefits of testosterone, Josh, if you put that up there. You will see this kind of an ad in the print, but you're going to hear it on cable news at least twice an hour on most cable programs. If this is a cable program that's going to have sports in it, or it's going to have motorcycles, or it's going to have race cars, they're going to talk about mega men, potency this, increase your sex drive, all of these supplements and vitamins that will increase your testosterone. Now, what that'll do is they have a chemical that can be converted to testosterone that is not like testosterone shots, which is what this guy is indicating that he might be taking. So these ads are going to say it's going to increase your sense of well-being and your brain health, right? It's going to make you have better moods, increased energy. What's that one say?
Strong muscles, improves love life.
Right. Love life and strong muscles. Let's get the guy with a lollipop, okay? So what they have in mind is this guy. He's got
Where did you get my picture?
Yeah, that's right. That was your picture when you were in your 30s, right? You got that one? And the reason they want to look like this guy is go to that next one where the guy's got the tape measure. Now, it looks like what we're doing here is we're measuring the tape measure. But we ain't measuring the tape measure. There's a gal hanging that tape measure, right?
Measuring the bicep, right?
Yeah, but that ain't what the guy's really thinking about. What the guy's thinking about is, if I got a bicep like that, I'm going to get a gal like this who's interested in how big my bicep is. So I'm telling you that most of the guys that I know that take testosterone, and I see them in the gym all the time, you can tell them. You can put that one down a minute.
They're buffed, huh?
Not only buff, but if they've been on it a long time, their jaw protrudes, because when you have reached adulthood, your cartilaginous growth plate in your wrist and your long bones stops growing, but your jaw can grow. So long-term, too much testosterone will get a bit of this. Now just think about your health club. This bone right there can grow. So this bone can become prominent over your eyes, and when you get a muscle like this, y'all can look at this in a few minutes here. When you get a muscle like that,
which way's the hot dog stand?
you get stria. All right. So now let's go to the next one here.
Wait a minute. What's stria?
That's stripes in where your skin stretches.
Okay.
Like a pregnant woman. Okay. When she goes back, she says, "Oh, I got stretch marks."
Okay.
Okay. Stria are stretch marks in a man's biceps or pectoralis muscle.
Got it.
All right. Let's go to the next one. This is the same ad you're going to hear on the TV, except right now they're talking about Monsanto's Roundup. Or they're talking about
that's all I hear about.
Asbestos, right?
Yeah.
Well, this was in there for a long time, and this campaign actually was in Britain. It's a
UK study.
That's because they don't think Monsanto Roundup causes cancer over there, and they don't think that body powder causes ovarian cancer, and they've already got their mesothelioma and asbestos things solved by a British law, but they don't have testosterone. So if you're in Britain right now watching cable television, you will see ads about, what does it say?
Testosterone linked to greater heart attack risk in men, UK study shows.
All right, so the question was,
Just got my pills.
can testosterone cause heart problems? My wife's worried. So yes, there it can. Now let's go to the next one.
What do we do about it?
What are we doing about it? All right. Now, this one here is FDA. You got FDA there?
Right.
This is it's not near as big an article, is it? This
Nope.
is not. This isn't an ad on TV. This is an article in the back of the newspaper. Back of the newspaper, the lawsuit challenged that these testosterone drugs were safe. There were you can pull that down. There were all of these ads for years about the axillary rub-on. Remember testosterone on TV?
Yep.
About the rub on your shoulders. Have you seen a single? You see all these ads. Ask your doctor about this for psoriasis or arthritis or for cancer. You haven't seen an ad yet about ask your doctor about rolling it on your arms or under your arms for testosterone in about 10 years. And that's because the FDA got all over those manufacturers for hinting that giving testosterone on the skin to enhance your mental aspects and make your
All of
sex
the
life
top
better
10, yeah.
was safe.
Got it.
So it ain't safe. Lastly, let's just pop up that harmful effects of testosterone boosters just 1 second. You'll remember the Lyle Alzado and those guys all were very well advertised that they had liver cancer or heart failure requiring a heart transplant and died because of the long-term use of testosterone.
Lyle Alzado died of brain cancer, didn't he?
No, it was liver.
Liver?
And that was before they had tested in sports for the use of testosterone. Think of the Barry Bonds era and that sort of thing. The tobacco industry had all of those spit tobacco ads where the guys had the So the harmful effects of testosterone can become, the one that bothers me a lot is the anger, rage, and aggressive behavior. You'll recall a guy who lived in Sugarloaf, who was a professional wrestler, who was on testosterone, who killed his killed his wife, killed his son, who he had on testosterone because he wanted the boy to be bigger and be a better football player, and then wrapped the wire of his weights around his neck and dropped 500 pounds and cut his neck. He was on testosterone at a high dose. It was causing the anger, aggression, and paranoid behavior, and twice in the prior 6 months, the Gwinnett County Sheriff's Department had been to his home because he had aggressive behavior or was screaming at a neighbor or something. And that type of aggressive testosterone is harmful to the general public. The other harmful effects are all on the user.
Yep.
So if a guy says, I don't care if I get liver cancer, I want to look like this. I don't care if my testicles shrivel and I become impotent. I don't care if I get any of these other things, then he's only harming himself. And that's a little bit of our freedom of smoke if you want, freedom to not wear a motorcycle helmet if you want. But I believe that the testosterone and the way that these people are talking about using it has harmful societal effects like alcoholism does, and it really needs to be aggressively fought.
That's great information. Good stuff.
All right, good.
Well, let's see. Doc, Brian has given me talking points. He says, at this time, you always share with us the most recent news in medical world. What have you got for us today?
Well, you remember I was telling you about the bad air in,
Yes. Bad gas in DeKalb County.
No.
No, Ackworth?
Bad gas in Smyrna and
Smyrna.
Vinings. Smyrna and Vinings.
Yeah.
And one in Gwinnett.
Yeah.
So everything in Smyrna is now called Sminings. And I told you right there, I said, look, there ain't much risk there. It's kind of like that risk from the have your granite home being over the not argon of anyway. You remember that?
Yeah.
All right. So they've now got it so blown up out there that Cobb County, radon, yeah, Cobb County, and they're going to go and measure the air everywhere, and it's a hoot.
Crazy.
The other one I thought, we know somebody here who got themselves a joint replacement made on a 3D printer to a CT scan of their own knee.
Right.
Just in the last few weeks, what's this organ that they're getting ready to transplant?
They're making a human heart out of collagen. Wow. Seriously?
Yeah, an infant human heart. I don't. You're probably 5 years from that, but you can use that printer with tissue culture human tissue to make an organ like a muscle or something. Now I don't know, and nobody knows if that thing's going to beat, but at least they're at the point where with tissue culture they can have heart muscle that they can put into that machine, and it can 3D make a heart. Now I don't know how you're going to make it beat, and they haven't gotten that far yet, but when I saw that, I got a little scared. I'm a little bit scared about, I think gene profiling of cancer is wonderful because it allows us to get targeted therapy. But when you start messing with your chromosomes, and you're talking about fixing the super kid and messing with stuff that's
don't mess with Mother Nature.
Yeah, well, don't mess. Yeah, okay, call it Mother Nature. I don't want to mess with what God made down here.
Yeah, there you go.
Anyway, so I'm gonna stop right there. We aren't gonna talk about flu shots. We'll be talking about by the time I get back from Russia.
You can share our Ask the Doc segment with your friends. Just go to YouTube channel, Fetcher News FYN-TV, and look for the playlist Ask the Doc. We want to thank Georgia Cancer Research Center today, affiliated with Northside Hospital.
We want to thank Josh for finally getting us up.
Josh did a great job this morning. He keeps us cool. There's no panic.
No.
The only panic is the host because...
No, I saw him pulling his hair out. He put his hat on to cover it up. He got a bald spot in the back. Now, Josh, you went through 10 minutes of real pressure there without losing your cool.
We got started a little bit late today, but we're here and we're glad that Doc joined us this morning. I'm substituting in here for BKP. You got a little traveling to do. You got a full day, and then
you'll have some good substitutes in here in the next few weeks.
Good deal.
All right.
Good to see you. All right, we're going to take a break for a minute. We'll be back with the All-Star panel. Richie may show up today. You may be late. I don't know, but Bruce and Jane are here, ready to tackle the problems of the world.
Let's do it.
Take us to break, Josh.